then, of course, we have to get back to the business of who I work for. And I work for my patient, exclusively for my patient. And that gets me to the 10 Commandments. First commandment, patients should be free at all times to choose their own doctor, hospital, and treatment plan. Now that's more important than you think. How many of you have heard of the concept of P for P, pay for performance? Have you heard about that? It's wonderfully articulated, but it has nothing to do with legitimate performance. Nothing. It means that I've ordered a mammogram even on a 90-year-old who has no breasts, because I will get credit for that, and I can get paid more for that. Now, she doesn't have to pay for that, so she doesn't say, why do I need a mammogram? Now, obviously, that's an exaggeration. But the fact of the matter is that when somebody else is paying me to perform in what I call a population-based model, as opposed to address the specific complaints of the patient, we've lost the battle. When people ask me what I do, I tell people that I sell my patients a better day. That's what I do. And every patient defines that differently. Thank goodness. Thank goodness. A better day for an 80-year-old may mean waking up in the morning without a headache. A better day for a 40-year-old may mean something entirely different. But my job is to provide opportunities for them as is medically necessary so that they can feel productive and good at the end of the day. Does that make sense? I don't sell them a mammogram. I sell them the relief that they don't have breast cancer. And if that isn't necessary to relieve them of that concern, then perhaps a mammogram isn't what I should be suggesting. Perhaps a breast exam. Doesn't cost anything. And I teach every one of my patients how to do it on a monthly basis. And then, when they find something, they call me. And when they call me, they get taken care of that day. Not a year from now, and not tomorrow. Why? Because they have concern now, and the loss of a night's sleep is not a better day. And when they have their mammogram, they get the result immediately thereafter. Why? Because I ordered it so I know what the result would be, and I can address their complaint specifically. Yes. Not next year. Not I'll call you in 2 weeks. But they're there now. They're not going to sleep, their sister isn't going to sleep, and their husband isn't going to sleep. So they get an answer right then and there. And that's what I sell my patients. Which is why I only have 500. Because you can't sell that to 2,500, which is what is the number of the average primary care physician. Make sense? Healthcare decisions should be made by the patient and physician working together in collaboration, obviously. I don't tell my patients what they should do. I give them opportunities. Here are the opportunities. Here's what it costs. Here's how it might help you. Here's what the literature says. Here's why the literature doesn't make any sense, as in the Zedia and Vytorin story, for instance. When on the day that story broke, every one of my patients who were on those drugs got an email from me or a phone call, so they didn't have to worry. Pretty simple. Because you know what? That story cost this nation $50 million. 1 million people on those drugs, $50 for every visit. $50 million in wasted health care because the study is nonsense. If the physician finds that the patient is not competent to participate in these decisions, the physician may defer first to the patient's family or to the courts. Very important. We spend a lot of money in that legal opportunity, and that's a subject for a different day. The doctor-patient relationship is confidential. Confidential. And it should never be regulated by outside agencies. I mean, we talk about privacy, and then your insurance company asks me to call them up so that I can tell them about your venereal disease. Hello? And you don't even know the person that I'm talking to on the other end. And they're going to authorize that? They don't even know you. How could they possibly? How could they possibly? So the privacy is incredibly important. Incredibly important. And the whole authorization process really obviates that opportunity. Doctors, hospitals, and all other licensed providers should be free to contract directly with their patients, provided they make their prices transparent and readily available. This is the coolest of the 10 Commandments. In Long Beach, we have a website healthylongbeach.org. And this is a website that I worked on with all the hospitals and providers in Long Beach. And what we've done is we've posted all the retail prices. Yeah, every doctor, every hospital, imaging center, everybody posted their prices. This is access to care. So now, when Bernie needs to know, thinks that he might want an MRI, he can go and see where it might be least expensive. And when I talked to Memorial Hospital about this, it was really quite interesting. They said, what if our MRI costs $500 and Los Alamitos costs $400? And I said, I guess you'll have to give $100 more of service. And then there was silence. And they go, we get it. And I said, yes. Because you see, charging $100 more might initiate the radiologist coming out and saying, Mrs. Smith, come back and look at that mammogram. Come and look at that MRI. Let me show you the result right now. Would you pay $100 to get that result right now? You may or may not, but shouldn't it be your choice if you want? So selling a service is not only affordable, but I think it is absolutely mandatory in our profession, and I think we need to be absolutely transparent.
What was the website?
The website is www.healthylongbeach.org. Now here's the really cool part about that. This website is actually a template, and we will offer it to any demographic community in the country. And before you know it, every single demographic will have posted prices and will have access to care. Access to care is not a card. The only thing that card buys you is access to a line in an emergency room. It doesn't buy you care. It's usually restricted, et cetera, and you've heard that conversation already. So I think access to care is, hello, my name is Debbie and I need help. And I answer the phone. Hi, Debbie, how can I help you? And in spite of the fact that I have my concierge practice, we have never turned a patient down, never. So when a patient walks into my office and they need help, we just take care of it. It is my pleasure. And we have about 10% of our patients on a scholarship program. They pay me nothing. In exchange for that, they offer community service to a 501c3. And this is a foundation that I'm starting up, and this is the answer to the uninsured in the country. We can talk about that later.
Wow.
Actuarial risk is the business of the payers, as I already discussed, and not healthcare providers. Physicians should not be in the business of assuming risk. It really does. We're human. I drink Diet Coke. I do all this stuff that everybody else does. I am human. And if you're going to put money in front of me in time, I'm going to find a way. Not because I'm bad, and not because I don't want to address my patient, but because I'm human. And I think that the world expects physicians to be different than that, and we're not. I think we're better than most, but I don't think we're not human. And so you have to allow us to be human, and when we accept risk, sometimes we're going to make not such good decisions, and I'd like to be out of that business. Payment of benefits is between the payer, either private or public, and the insured. Payment for services is between the patient and the doctor, hospital, or other provider of care, and the two should not be mixed. That's also an important. That gets back to my stay in your cage. The patient should determine the quality of care. Standards of care are the decision of specialty organizations and should be published and available to patients. Physicians within that specialty network should do peer review exclusively and confidentially. I'm going to leave the discussion of peer review to my colleague Gil. But in effect, we need to have subspecialty standards that you are aware of. But the quality of your care can only be judged by your physician. It isn't up to your health plan to decide the quality of care. And by the way, all of that muckety-muck is just about driving patients to places where the care is cheaper. That's a discussion for a different day. But if you are my patient and I work for you, then you determine the quality of my care, which doesn't mean I don't give you access to specialty services, to secondary providers, to fifth opinions if you want, but you need to be the ultimate decision maker in terms of quality. Any tax benefit for the purchase of health care or health insurance should accrue to the individual patient or insured, and that gets to, of course, employee benefits. I believe that all of that should be held by the patient and it should be portable, etc. And then finally, there shall be no unfunded mandates. With all due respect to our legislature, and I do respect our legislature, every mandate is terribly expensive, and they're all unfunded. Between you and me, it is disturbing when I read in the paper that our legislature, not our state, but our federal legislature, decided how long a woman should stay in the hospital after she'd had a baby. Excuse me? And you got your education where? And we're supposed to be following those mandates. Again, this gets back to everybody needs to stay in their cage.